This is our annual recap of the previous year, and I just want to quickly introduce my executive team for everybody who maybe you're newer to the board or hasn't met all of you. On the far left, we have Kathy Dokees, our Director of Indigenous Public Health. Next to her, Stacey Laforest, our Director of Protection. Then is Stacey Gilshan, Vaccine Preventable Disease. We then have Rennie St-Onge, our Director of Knowledge and Strategic Services. Dr. Emily Groot, who's our Associate Medical Officer of Health. And then finally, a temporary addition to our team here is Dr. Blessing Odia. She is a trainee at NOSM, a physician who is doing a final bit of specialty training in public health preventive medicine and is working with me over the next 6 months to get that last bit of training. And many of these members have all contributed to the presentation here. We'll have Kathy and the two Stacys help to present with me today. As you're well aware, we in public health are always trying to find ways to better the health of the community. We work upstream, we try to identify what are the biggest problems of health in our community. We reach out to partners whom we can work with, and we really try to use the best scientific evidence to put forward the best quality services that our residents can benefit from. And really today's presentation is how all of those dots are connecting, the needs, the science, the evidence, the partners to be able to deliver to our population. For those of you who have been part of the Euro interview presentations in the past, they are usually quite detailed presentations. We've presented lots of data on the full breadth of our programs, and we're taking a bit of a different approach this year. We, of course, are now recording these presentations to make them more widely available to the public. And when you present a lot of breadth, I think sometimes it's hard, especially for members of the public, to really understand the relevance of all the issues and really get a full appreciation. And really with the sea of connecting the dots, we want to be able to do a deeper dive. And so today's presentation, instead of presenting the full breadth of everything we do in public health, we've picked out 4 key areas, which we think are really representative and highlight some of the key stuff that happened in 2024. And we're going to do a bit of a deeper dive into that. Okay, so the 4 topics that we've presented are these. We're going to talk about Indigenous public health and how we're creating more spaces for Indigenous voices so that we can improve the way we serve Indigenous populations. We're going to talk about outbreaks in vaccine preventable diseases. This is an area where we've seen a resurgence of infections. It's been a particularly important area in this past year, and we want to tell the story of that. We've just heard a little bit about oral health. I think that's something that's very much in the public consciousness right now, and we want to talk about how we support healthy smiles at every age. And I think everybody sees substance use as one of the biggest challenges we are dealing with in our society. And so we're going to talk about how we are trying to address this complex problem with some complex solutions. And so with that, I'm going to call in Kathy Dokees to come up and do the first part of the presentation.
Thank you, Dr. Gurji. I'm happy to be here today to discuss with you creating more spaces for Indigenous voices. So our journey began with building cultural competence a few years ago. We are now taking the next steps to build deeper engagement with Indigenous partners and communities. We're starting to take next steps into some areas by changing how we deliver services. This includes having Indigenous voices at all levels, all decision-making levels, integrating Indigenous considerations into our program planning, and preparing for the Unlearning and Undoing White Supremacy and Racism project. As a midterm priority, the Indigenous engagement strategy demonstrates the agency's commitment to reconciliation. The Indigenous engagement strategy emphasizes the importance of building trust and fostering meaningful relationships with respect and humility. Health systems have caused harms to Indigenous peoples for generations. So it is our responsibility to engage Indigenous communities respectfully. The importance of this work goes beyond just our program delivery. It is about adhering to the commitments that we have made and understanding and addressing the systemic inequities in order to improve health outcomes for all. The team, which was previously comprised of the Special Advisor, Indigenous Affairs, and one health promoter, Indigenous Engagement, doubled in 2024. So recognizing the need for more Indigenous voices, Our executive committee hired a director of Indigenous Public Health, and this milestone appointment took place in January of 2024, triggering significant and positive changes and impacts within the organization. The special advisor role shifted to manager of Indigenous Public Health, and the interim health promoter stayed on to round up the team with 2 health promoters, Indigenous engagement. This increase in capacity has really helped us to enhance the outreach of our program across the agency, allowing us to achieve more ambitious goals for our Indigenous engagement work within the organization. These roles ensure that Indigenous voices can be heard and respected at all levels throughout the organization. Furthermore, the organization saw a fundamental change in public health and midterm priorities and decision-making. Indigenous voices can now actively shape policies and priorities at all levels within the organization. These changes marked a departure from our previous focus on Indigenous engagement and a deliberate transition toward Indigenous public health. The shift to Indigenous public health reflects our growing recognition of Indigenous people as rights holders rather than as solely equity-seeking groups. It acknowledges their inherent rights to self-determination, governance, and their leadership in shaping health outcomes. The change has set a new tone within our agency, a tone that is grounded in respect, collaboration, and commitment to decolonizing public health systems and structures. In 2024, we held a First Nation and Urban Indigenous Public Health Knowledge Exchange, an inaugural fall harvest feast for the urban Indigenous population. And we worked with the research, evaluation, and knowledge exchange team to incorporate Indigenous engagement in 2025 program planning. We also launched the internal Indigenous engagement orientation module, so for all new staff joining public health, separating districts, and we continue to engage with our partners. We also worked with the health equity team to develop and prepare the Unlearning and Undoing White Supremacy and Racism project that has been adapted for our agency from the BC Office of the Provincial Health Officer. And of course, as a team, we always create space in our work to respond to the reactive work that sometimes arises within the organization, as well as from our partners. At the Fall Harvest Feast, we heard firsthand how deeply trust shapes the effectiveness of public health. One participant shared that if we don't trust you, we won't access services, highlighting that without ensuring that we continuously work towards our agency value of trust, engagement is impossible. The event was a testament to how meaningful relationship building leads toward our path forward. These moments of shared understanding are crucial as participants express that they found value in our efforts and are really eager to continue to collaborate with us. It further reinforced the importance of ongoing engagement to ensure our services meet the needs for all. As we look forward to 2025, the foundation that has been laid in 2024 has set the stage for more significant momentum. With increased capacity and more Indigenous representation within decision-making processes, Indigenous public health is poised for greater impact. We continue to prioritize relationships, community-driven strategies, and partnerships to ensure our work is not only culturally relevant, but also effective in addressing health disparities. We are really excited for the future and ready to continue building on the momentum we have established. Miigwech, Melcy, thank you, and I'd now like to invite Stacey Laforte to speak.
Well, good afternoon, everyone. It's a pleasure to be here to discuss the importance of protecting clients during times of rising infections. Preventing illness and mitigating risk is part of public health's core mandate and contributes to our agency's overall mission, vision, and priorities. Infections are higher than they have been in recent years. Respiratory infections, sexually transmitted infections, and tuberculosis infections have all increased. As we prepare for future pandemics, avian influenza emerged in 2024 as a particular concern. Measles infections were also high in Ontario for the first half of 2024. While we had no infections in our service area, we did invest in some preparedness work, which is even more relevant today. Working with partners such as long-term care homes, hospitals, and other healthcare partners ensures clients throughout our service area are protected. Respiratory illnesses are one of the top 5 causes of death in Canada. Syphilis or other sexually transmitted infections contribute greatly to infertility and congenital anomalies. Throughout 2024, we collaborated with partners to prevent further outbreaks and severe illness related to diseases such as respiratory viruses, syphilis, and other sexually transmitted infections. On this slide, you'll see highlights displaying the number of outbreaks and infections public health staff responded to in 2024. You'll also notice that in most instances, the number of infections have increased substantially since 2019. For further background, for whooping cough for the years 2020 to 2022, all years had 0 cases reported, and in 2023, there were 7 cases. This compares to 39 sporadic cases in 2024, as seen on the slide. In 2024, there were 13 active tuberculosis infections reported locally, compared to 0 active infections in 2019. Syphilis counts have increased dramatically in recent years, with 138 infections reported in 2024, compared to 139 in 2019. As part of public health's direct core mandate, we work alongside other healthcare partners to prevent and respond to illnesses and to increase the public's awareness about actionable preventable measures that they can take, providing communities with the necessary tools, resources, and programs to protect themselves and those who matter most. So here's just a few examples of what collaboration for the agency looked like in 2024. The infection prevention and control team worked with institutions to not only mitigate outbreaks, but to further educate and support them to prevent illness in the most vulnerable clients. Concentrating on increasing accessibility for clients, public health especially focused on conducting tuberculosis infection assessments and providing access to much needed medication for treatment of the disease. Staff continue to conduct proactive work, including routine inspections and site visits, and dedicated time to plan educational resources, such as the Managing Syphilis and Primary Care session that was provided by Associate Medical Officer Dr. in 2025. Health Protection conducts comprehensive infection follow-up and contact tracing with all individuals identified as at risk for transmission of a disease of public health significance. Examples of diseases of public health significance include measles and whooping cough. Many investigations are complex and can include management of diverse social and behavioral factors, logistical challenges, large group exposures, language barriers, timely coordination of testing and treatment, navigating apprehension of public health or implications, and stigma of the investigation. Health communication efforts provide necessary public education and timely information and empower community members to make informed decisions. Throughout 2024, public health continued to improve the safety and the delivery of services, providing positive impacts to communities throughout the service area. With case counts of other diseases like avian influenza on the rise globally, we also focused on managing and mitigating risk by conducting risk assessments, completing ongoing surveillance, and conducting public education campaigns. Human cases of avian influenza remain rare, typically resulting from direct exposure to an infected bird or contaminated environments. Vaccination of seasonal influenza is a critical tool to reduce the likelihood that an individual will be infected with both viruses simultaneously, resulting in the potential for the creation of a new virus that is easily spread person to person. Public health has laid a solid foundation for its response through careful planning, preparedness initiatives, and active surveillance. We know that ongoing surveillance is a critical component of our work. We monitor global trends and assess risks in real time and participate in enhanced surveillance programs initiated by the Ministry of Health to stay ahead of emerging issues. Collaborating with wildlife health partners also increases our understanding of the virus's spread in animal populations. We prioritize preparedness initiatives like managing human health cases, educating the public, and providing mental health support to impacted individuals. Our communication strategies are aligned with provincial and federal partners. By mapping out roles and responsibilities, we're ensured that each team member understands their part in our response framework and that this connects with provincial and federal strategies. Internal planning sessions at the team and division level have helped streamline workflows and refine responsibilities, ensuring our teams are well prepared to act quickly and effectively. We have also participated in provincial meetings with all local public health agencies hosted by the Ministry of Health to clarify roles and responsibilities. When notified of a positive case, bird or human, public health units initiate contact tracing to assess the exposure risks of each contact. We provide clear guidance in regards to monitoring symptoms and testing if necessary. Contacts of cases may be offered treatment to prevent illness, as well as the seasonal influenza vaccine. The Vaccine Preventable Diseases Program has become increasingly complex with the introduction of new vaccine programs, changing provincial expectations and requirements and funding for COVID-19 vaccine administration and COVID-19 cold chain responsibilities. In addition, there was a focus on updating and obtaining COVID-19 vaccine program agreements with partners, providing COVAX support for partners. COVAX is the provincial database for reporting COVID-19 vaccines. Public health assists partners to utilize the database effectively. Expanding eligibility for the older adult program for respiratory syncytial virus and introducing the infant and high-risk children respiratory syncytial virus program. Coordinating changing demographics due to the international records and complex catch-up schedules was an area of focus. There has also been an increase in vaccine hesitancy and misinformation. We understand that people's trusts in vaccines may be shaped by many factors, which is why we continue to address concerns throughout 2024 and promote vaccine effectiveness and safety. We continue with recovery efforts to administer routine vaccines due to the interruption from the pandemic. We also continue to implement the Immunization of School Pupils Act for all grades and all schools across our service area. Here's just one example to demonstrate enforcement in 2024. On September 1st, 2023, the measles coverage estimates for local students aged 7 to 17 was 90.9%. And by July 1st, 2024, the coverage increased to 95.9%. Achieving and maintaining high immunization coverage is essential for effective prevention and control of vaccine preventable diseases, which allows public health to minimize the risk of outbreaks throughout our service area. Waning immunization can result in the spread of vaccine preventable diseases. Vaccination remains the best protection against vaccine preventable diseases and actively contributes to the agency's vision of creating healthier communities for all. Now I'd like to invite Stacey Gilbo to the podium to provide her conceptions of the presentation.
Thank you, Stacey. I'm here today to talk about two different narratives for 2024. The first is centered around healthy smiles at every age. So why oral health is important? Good oral health contributes positively to your physical, mental, and social well-being, allowing you to speak, eat, and socialize without pain, discomfort, or embarrassment, and reducing your risk of certain chronic diseases. For example, patients with no access to dental insurance visit emergency rooms for non-urgent dental conditions, although their issues are rarely solved by emergency care. These avoidable costs, the healthcare system an estimated 1.8 billion in 2017. Individuals with gum disease are 2 to 3 times more likely to have a heart attack or stroke than those with healthy gums. So let's take a look at oral health for children. Specifically, an estimated 2.26 million school days and 4.15 million working days are missed each year due to oral health concerns. Dental surgery under general anesthetic accounts for 1/3 of all day surgeries performed on children between ages 1 and 5 at pediatric hospitals. The Canadian Dental Health Association recommends the assessment of infants by a dentist within 6 months of the eruption of the first tooth or by 1 year of age. The goal is to have children see the dentist before there is a problem with teeth. In most cases, a dental exam every 6 months will allow the dentist to catch small problems early. Early dental visits set children up on an upward trajectory towards a lifetime of positive oral health. Aside from the impact of potential dental surgery and the potential loss of time at work or school, health behaviors established in childhood will extend into adulthood and can influence oral health outcomes later in life, which impacts their general well-being. So now let's take a look at oral health for seniors. Having access to oral health care means clients in this stage of life lower their chances of suffering from gum disease, contracting dangerous bacterial pneumonia, or worsening diabetes. Older adults, especially when they require the help of someone else, may be facing barriers in getting oral care. Oral adults may feel uncomfortable with the caregiver's technique of physical closeness. They may fear some anxiety or worry, either because of past negative dental experiences or attitudes toward oral care. They may not be able to afford dental treatment or to physically attend these appointments because of transportation issues. And they may have to rely on caregivers who are hesitant to provide oral care because lack of time, skill, or understanding of the importance of oral health. These barriers are even more challenging for older adults with dementia who can show more resistance to necessary care. The public health offered screenings which took place in all schools within the service area for the 2023-24 school year. We screened over 11,000 elementary school children across the service area. 795 students were identified with urgent dental care needs, and public health followed up with these families and assisted them with applying for financial assistance through the Healthy Smile Ontario program and monitored their progress. 533 senior clients either received care at the Seniors Dental Care Clinic or were referred to contracted dental providers who participate in the Oral Seniors Dental Care Program. In 2024, the oral health team also had more capacity to focus on early prevention, engage with Indigenous communities, and assist the more vulnerable populations. So where are we headed in 2025 with oral healthcare programs? We're exploring ways to increase access for seniors, such as those in long-term care facilities or homebound. We continue to increase access to preventative services, and we're also prioritizing increasing Indigenous engagement across the service area. And the oral health team also supports our district offices through a variety of offerings, including additional preventative clinics, offering dental screening clinics for children and youth under 17, and conducting ongoing recruitment of oral health professionals. We also facilitate the applications for the Northern Health Travel Grant Program. I will now conclude with our 2024 year in review by speaking about the toxic drug crisis. Creating comprehensive solutions built on reducing substance-related harms across the entire substance use spectrum care can have a substantial impact on the well-being of individuals, families, and the overall community. Public health continued its efforts in 2024 to decrease barriers, address stigma, and increase public awareness and education surrounding substance use. This is a fictional narrative about a person named Casey. Perhaps you can personally relate to this story, or you know someone who is in Casey's situation. So Casey is a youth in secondary school who is struggling with bullying, schoolwork, and parents who are busy with work. They are feeling stressed and has tried using alcohol and drugs with friends to help cope with these difficult emotions. At Casey's school, there are supportive adults who identify that they are struggling and offer support and connection. Casey is encouraged to attend an event at a local youth drop-in center. At this event, there are peers and other adults who encourage Casey to explore their love of sports. The center has accessible and low barrier recreational programs for youth to engage in and spend their time. Casey is also able to get help with their homework and studies, which helps them feel more confident in school. The Youth Drop-In Center also offers primary health care and counseling services to youth. By spending time at the center with adults, supportive peers, and enriching programs, Casey is able to access counseling services, make new friends, learn to manage their emotions, and has learned about the risks and benefits of substance use. Alcohol and drugs have lost some of their appeal. This all happened because a community of educators, parents, guardians, recreation programs, and other organizations have come together to support youth in the community. So building on the recommendations from the Greater Sudbury Summit on Toxic Drugs, the community drug strategy realigned its structure to better meet the evolving needs of the community, including refocusing on harm reduction. This includes engaging and supporting people who use substances with harm reduction to help support them in a journey to better health. The community drug strategy takes a comprehensive approach by focusing on the root causes of health disparities through health promotion and offering support services such as housing, employment, and substance use care. To ensure the strategy is responsive to those most impacted, the work is guided by the voices and perspectives of people with lived and living experience of substance use and equity-deserving populations. Public health also focused on health promotion and prevention by exploring collaborative strategies aimed at supporting youth. Approximately 15 community partners came together to educate, engage, and work together in creating supportive environments where all youth have equal opportunities to achieve health and well-being. Together, this group began plans to adopt the Icelandic prevention model, which is a comprehensive approach that brings together parents, guardians, and teachers, sporting centers, and other community organizations that engage with youth regularly. As a supportive voice focused on creating healthier communities, Public Health also joined other harm reduction community partners to safeguard individuals by distributing essential supplies and safer alternatives to reduce potential risks and promote substance use health. As part of the homelessness network, staff continue to offer other frontline supports, resources, and consultations to find safe, essential solutions for those impacted. So where are we headed in 2025 for substance use? One of our main focuses is to work with our community partners to adopt the Icelandic prevention model. We will also continue to work with community partners on harm reduction efforts, supporting people who use substances. And finally, we will move forward with some of the top priorities from the Greater Sudbury Summit on Toxic Drugs. I will now turn things over to Dr. Kirji to continue the presentation.
Okay, a big thank you to members of my team for providing those 4 stories here. I hope as we went through those 4 stories, you really got a better understanding of what is a health problem that we're addressing, how we think about it in public health, and what we're doing to address it. how we pull in partners, how we use data, how we engage with the community and with clients so that we can best serve the population as a whole. As mentioned, this presentation is being recorded. We'll be making it available on our website so the broader public will have access to learn these same things as well as understand, and hold ourselves accountable to the public for what we're doing. We're also going to be putting up some messages on our website articulating these stories, and we'll be sharing the elements of these stories on social media to make sure that this gets wider understanding. With that, Mr. Chair, I'm happy to turn it over for questions.
Okay, thank you, and thank you to your team for the great presentation and the detailed information. Is there any questions from board members during the presentation? One button, go ahead. Right. Hey, Bob.
First of all, it's great presentation. It's obviously a really good indication of the amount of initiatives you've undertaken in 2024, which is really impressive. I guess I have a very hypothetical question I was going to ask of Dr. Kirchie when we got around to talking about his report, but maybe it's more appropriate to ask it now. So given the lessons we learned about the COVID-19 pandemic, what's your sense of our level of preparedness should we have another pandemic a year from now? Like, what's your sense of our state of readiness as a health community?
So, Mr. Chair, I think as a public health organization here, we have done a really detailed look at what occurred with the last response. We have really learned some of the lessons, and we've taken efforts to implement those lessons in the last couple of years. So I do think as an organization here, we are better prepared with some of the lessons that we've learned. Looking more broadly, I do worry that our society as a whole is not as well prepared as we were, even for perhaps the last pandemic. There has not been a review at the federal government level, at the provincial government level, to really learn the lessons and really put in place some of the measures that could protect us. I think the sources who create misinformation and distract the public on good science-based decisions have really grown in strength, and they've learned lessons how to mislead the public better than we have learned the lessons of society to combat that. And I do really worry that while at the local level we might do a great job, the pandemic is not something that happens locally. It happens globally, and we need action at higher levels of government is going to be equally strong. And so, unfortunately, I don't think we are going to necessarily see as strong a response at those levels. But just noting that at its January meeting, I believe it was, the board did pass a resolution calling on the federal and provincial governments to move more swiftly around learning some of those lessons and including some of the preparedness measures that they should.
Thanks. That's a bit troubling, but great presentation.
Thank you for the question. Any other questions of board members or presenters? Ali?
For you, Mr. Chair, I don't know if you'll be able to answer it or not, because it's fairly recent in the news. Actually, I think I read that this morning. We all know what's happening in the States with Mr. Kennedy and how he's transforming everything. So they are taking a new approach to COVID-19 vaccination where they're no longer recommending it or offering it other than people that are 65 years of age or over, or vulnerable populations. I'm wondering if you foresee that Canada will take a similar tangent, or if it will continue going forward with preventative vaccination like we do for influenza.
Okay.
Yeah, so Mr. Chair, I don't think I have a clear sense exactly where we are headed yet as Canada.
Okay.
Thus far, COVID-19 vaccine has been purchased by the federal government, and they've made it available to provinces with the expectation that everybody should have access to them. The federal involvement in this is ending, and as it's a healthcare measure, it's being passed down to the provinces. So provinces are going to be designing their own plans and programs of how things are going to proceed, and we haven't quite heard the details of that yet. I am optimistic, though, that our vaccine advisory bodies are continuing to recommend vaccination for really children through all ages, with a strong emphasis on those 65 and up to get it actually twice a year, and people with underlying medical conditions to get it twice a year. And so I am optimistic the provincial government is going to actually create a fully funded vaccine program eligible for all ages, with additional vaccines for those who are most at risk, who are older and have underlying medical conditions. But it hasn't been formally announced, so we are still waiting to hear back from it.
Thank you.
Thank you for the question. Again, any other questions, board members? Hearing and seeing none, thank you again for all the detailed presentations and for the reports.